Hello everybody, I am Dr. Debdatta Bhattacharya, consultant cardiologist. Today is the 18th of May 2021. We are right in the middle of the second wave of the COVID-19 pandemic. The first wave ended roughly around January or the early weeks of February. And at that time, we behaved in a way that has resulted in the second wave. We forgot about social distancing, we forgot about hand hygiene, we forgot about mask wearing. We went to large religious gatherings, oblivious of the fact that the virus was still lurking amongst us. And we went to large political rallies without social distancing and without wearing any masks. All this and other social gatherings has resulted in a huge reinfection and a huge second wave. This second wave is going to infect millions of people and it is going to kill thousands. Already more than 2.5 lakh Indians have lost their lives in the COVID-19 pandemic, and many more are going to lose their lives in the coming months. One of the ways we can combat this is being respectful to each other. Whenever we are going out, we should be wearing masks. We should take care of ourselves as well as the person who is next to us. It is only through the cooperative effect of everybody that we can minimize the rate of rise of infection. At the moment, the number of infections are so high that there is a crisis all over the country of oxygen, of medicines, of beds. Doctors are falling ill because they have been working for so long. And unless and until herd immunity or vaccination of a large mass of the population is done, this COVID-19 will strike again and again. And unless we are careful, unless we adhere to the principles of mask wearing and social distancing and hand hygiene, we will not be able to control this pandemic, and millions more will get infected and thousands more will die. We should not think that it is another person's problem. We should not think it is my neighbor's problem. It is not my problem. It is as much your problem as anyone else's. And if we are careless, if we keep doing things that we did at the end of the first wave, we will get a third wave after the second wave. And as epidemiologists are warning us that this third wave could infect children, and that could be a major crisis. I would request every one of you, those who have had the infection, those who have been vaccinated, those who have not been vaccinated, all of you to take precautions. Vaccination in our country is at a very early stage. Only 2 to 3% of the population has been vaccinated, and the target is to vaccinate at least 50% of the population. This is going to take some time, and during this time, millions of people are likely to get infected if we are not careful. So far as cardiac patients are concerned, those who have cardiac emergencies, they can come to the emergency department. The emergency department is open 24 hours of the day, 7 days of the week, and any emergencies are going to be attended by cardiologists who are on call round the clock. If you do not have a cardiac emergency, it is better not to come to the outpatients department, because during the travel to and fro from the hospital, there is a chance that you might catch the infection. It is much better to get your problems sorted out via video consultation, where you can see your doctor face to face and discuss your problems. Finally, before I leave, I would like to again re-emphasize that it is very, very important that for the next 1.5 years, we keep our guard up. We should not lower our guard, because COVID-19 is going to be with us for a very long time.